Good morning, everybody, and thank you for joining us today. I spent yesterday in western North Carolina, and I'll be returning again this afternoon. Our emergency responders are continuing to rescue people and rush aid to the mountains. The challenges are immense, but our joint response effort has and will continue to be massive. No matter who or where you are in western North Carolina, if you need help, we are working around the clock to reach you. Yesterday, I talked with first responders and healthcare workers whose actions have been heroic, and I thanked volunteers who are helping in every way they can. We know that the devastation brought by Hurricane Helene is beyond belief. Communities were wiped off the map, dozens of lives lost, hundreds of roads remain damaged or impassable. Communication has been difficult due to cell phone and power outages. Many people were waiting for days trying to get in touch with loved ones, and thankfully many of them have, but some of them are still waiting. Access to water is difficult for many people. Across the region, more than 460,000 customers are without power, down from a peak of more than 1 million. More than 1,100 people are being housed in 29 shelters. We're working together to open more major routes to push supplies forward while repairing roads, utilities, and communications. I-40 east from Asheville is now open, and I-40 west into Asheville will be opening this morning. But we continue to ask people to stay off the roads in western North Carolina unless travel is necessary. It's still dangerous on many roads, and your presence can impede rescue and recovery efforts that are underway. We're continuing to urge and help cell phone carriers to get cell phone service back up, and it's steadily returning. Utility companies are also working around the clock to get power back on. Yesterday, I went to the staging area in Asheville where our National Guard has been deploying to western North Carolina counties hundreds of thousands of pounds of food, water, and other supplies. Those life-saving items are helping people across the entire region, including airlifts to communities that are not reachable by road. FEMA is working with us on the ground, in addition to other help. They've delivered about 1 million liters of water and more than 600,000 meals to North Carolina so far. The North Carolina Department of Transportation is working to reopen more roads, first by clearing debris and finding ways around major damage until repairs can be made. And we're grateful to the dozens of states and federal teams that have sent line workers, equipment, supplies, swiftwater rescue teams that, along with local, state, and National Guard, have rescued hundreds of people and many pets. I've briefed President Biden and Vice President Harris each on 2 occasions, and they have committed every resource available to this recovery. I appreciate the President's quick approval of our major disaster declaration this weekend and his direction that FEMA Administrator Deanne Criswell will continue to be here on the ground. She's here with us today. And now more than 57,000 North Carolinians have already applied for FEMA individual assistance, and they are already beginning to receive funds. To apply for FEMA assistance, go online to disasterassistance.gov, download the FEMA app, or call 1-800-621-3362. The telephone line is open every day, and help is available in most languages. I know many people are looking for ways to help. We activated the North Carolina Disaster Relief Fund managed by the United Way of North Carolina. Donations to this fund go directly to organizations providing relief on the ground. For more information or to make a donation, please visit nc.gov/donate. As heartbreaking as this damage has been, it's encouraging to see the way people are working together. I talked with a number of first responders and medical workers and volunteers who have left their own families to take care of our communities. Many of them had damage to their own homes. I'm deeply grateful for their sacrifice. That resilience and generous spirit will power much of this recovery. Today, I'm joined by Emergency Management Director Will Ray, FEMA Administrator Deanne Criswell, Transportation Secretary Joey Hopkins, Major General Todd Hunt, the Adjutant General of the North Carolina National Guard, Colonel Freddie Johnson, Commander of the North Carolina State Highway Patrol, Attorney General Josh Stein, and the Secretary of the Department of Health and Human Services, Cody Kinsley. We also have our Department of Public Safety Secretary, Eddie Buffalo, here. Our American Sign Language interpreters are Karen Magoon and David Payne. And behind the scenes, our Spanish language interpreters are Erica Kugler and Tamara Cabrera. We'll first hear from Emergency Management, Will Ray.
Thank you, Governor Cooper, and good morning, everyone. The State Emergency Response Team, along with assistance from states across the country, the federal government, the private sector, community organizations, and nonprofits are working around the clock to respond to the needs of Western North Carolina. Commodities are being shipped by both road and by air. Rescue efforts are continuing, and we will continue those until everyone that needs our help is assisted. This disaster is unlike anything our state has ever experienced. North Carolina is strong and resilient, and we will get through this together. For North Carolinians that have been impacted and need financial assistance, please begin that process with application to FEMA Individual Assistance, as the governor said, by calling 1-800-621-3362. You can also apply by visiting disasterassistance.gov or by downloading the FEMA app. As the governor said, as of this morning, over 57,000 survivors have already applied for individual assistance, with over $1 million already being dispersed directly to them. I want to remind all North Carolinians that conditions on the ground remain extremely dangerous. Roadways are damaged, buildings are damaged or destroyed, there are downed power lines and unstable ground, with the risk for landslides continuing. We need to keep both ground routes and airspace free for first responders and public safety to work unimpeded to provide services and restoration. There's a tremendous aviation operation underway to continue rescue operations, to distribute commodities, and to ensure the swift movement of commodities into those communities. I want to remind everyone also to please refrain from flying drones in Western North Carolina. It is a hazard to aircraft flying as a part of the response effort. There are 28 county states of emergency and 58 municipal states of emergency that remain in place, with 25 shelters open with over 1,100 individuals being served. I wish to thank those working in our shelters to provide displaced North Carolinians with food, shelter, and access to resources. The work you are doing is critical to helping our residents. As of today, there have been hundreds of rescues made by our North Carolina search and rescue teams, the North Carolina National Guard, local first responders, and by search and rescue teams from many other states. If you need rescue or have an emergency, please call 911. For general disaster information, please visit ncdps.gov/Helene to keep phone lines open for those that need them. There are 22 states that have responded to help in North Carolina, with over 415 personnel on the ground, and that is increasing. We cannot thank you enough for your support. If it is not an emergency and you need to report someone missing, or if you are requesting a welfare check, please call 211, select your preferred language, and then push option 1. Thank you to the United Way and to the 211 operators who are working around the clock to process an unprecedented number of calls, as well as our North Carolina Community Emergency Response teams who have volunteered to help with call taking and documentation. North Carolina 211 has received a significant number of calls from people concerned about their friends and family over the past several days, which are being logged to provide first responders with areas to search. Additionally, the American Red Cross has set up a reunification website for impacted southeastern states, which can be accessed by going to redcross.org. The North Carolina Office of EMS is working with impacted counties to ensure that both pre-hospital care and EMS systems are supported to provide life-saving emergency response. They have deployed EMS units, personnel, and are closely communicating with our hospitals and licensed care facilities to ensure that fragile medical populations are moved to safe locations and cared for. There are 2 state medical support shelters open to care for those that have been evacuated with acute medical needs in Western North Carolina. Additionally, 2 disaster medical assistance teams have been deployed into Western North Carolina to assist hospitals, and another is inbound to continue that support. I want to again thank the telecommunications professionals that have been working around the clock to restore cell phone service and mobile data to the mountains. We know there is more to do to improve access and coverage. For those in Western North Carolina, we ask that you turn your phones off and turn them back on periodically to allow the phone to connect to a network. I want to remind everyone that carbon monoxide is a concern when you are cooking on a grill or operating a generator for power during power outages. Please make sure you do these things away from your home, as carbon monoxide is a colorless and odorless killer. The North Carolina Office of State Fire Marshal has deployed 446 North Carolina firefighters with over 120 fire trucks to the mountains to assist the hardest hit communities. Thank you to the many fire departments statewide for answering our call for service. For general information, links to resources, and answers to frequently asked questions, please visit ncdps.gov/Helene. This website will continue to be updated with additional resources as we conclude the response phase of this disaster and begin to move into recovery. To learn more about how you can donate materials and supplies, visit ncvoad.org. Finally, I want to once again acknowledge those that have left their families and worked incredibly long hours in challenging conditions, responded to emergency calls for assistance, have staffed Emergency Operations Center and Incident Command posts across the state, as well as our critical healthcare facilities, to keep all North Carolinians safe. Thank you for what you do every day to protect the 10.8 million people that call this great state home. We are truly lucky to have such outstanding first responders and public safety professionals in North Carolina. This disaster is unlike anything our state has ever experienced. As we said at the beginning, North Carolina is strong and resilient, and we will get through this together. A note to our media partners listening. Unfortunately, our teleconferencing system is experiencing some technical difficulties this morning. For media listening in remotely, if you have questions about today's press conference, please email the Joint Information Center, and your question will be answered immediately following this press conference. Thank you.
Thank you, Director Ray. Now I'd like to ask FEMA Administrator Criswell to share an update.
Thank you, Governor, and good morning. Yesterday, the Governor and I had an opportunity to brief both the President and the Vice President, and I just want to share that their commitment to making sure all federal resources are available to support this response were articulated again and emphasized. And so I have committed to the Governor that I will stay here until the event is stabilized, and we will continue to bring in as many federal resources as are needed, not just for this ongoing response, but as we move into recovery. We have had resources here on the ground since well before the storm had impacts. We moved resources like our search and rescue teams and the Army Corps of Engineers. We have healthcare medical assessment teams, and now we have the medical assistance teams in the hospitals. We have aviation assets and communication assets that we have brought in. We continue to bring in more resources as we identify additional needs, but also to anticipate what is going to be needed to sustain this level of operation for the days and the weeks to come. And so, Governor, you have my commitment to make sure that we continue to bring every resource available, that we think creatively about the type of resources that we have, and that we make sure that there's no delay and we eliminate any bureaucracy in trying to engage them into this flood flight as well as the recovery operations. And I just want to close by reiterating that you can apply for federal assistance. If you have had impacts to your home, if you have been displaced, if you have lost your food because of a power outage, but you don't have damages to your home, please register for assistance. You can again do that at disasterassistance.gov. You can download the FEMA app. You can call 1-800-621-FEMA. But we also know many people don't have communications right now. And so we are also sending our disaster survivor assistance teams into the shelters to begin with to help register individuals. They will begin to go into the neighborhoods as it's safe for them to walk around. If you see somebody in a FEMA shirt, ask them if you can register. It might be one of those teams, and if not, they'll be able to direct you to where you can. And so, Governor, again, you have my commitment from the entire federal family to ensure you have any resource you need to support this ongoing effort. Thank you.
It shows the magnitude of this disaster to have the head of FEMA here on the ground so long and that commitment from FEMA, so we're grateful for that. I'd now like to ask Major General Todd Hunt, the Adjutant General of the North Carolina National Guard, to share his report.
Thank you, Governor, and good morning. And I want to also thank the citizen soldiers that are out there and airmen with their dedication and service as we propagate through this crisis. I want to give you a couple updates on what the National Guard is doing. Right now, we still currently have 800 guardsmen on duty with 275 vehicles. Those numbers will increase throughout the day. We are running two simultaneously operations with our emergency management partners, with DOT and North Carolina State Highway Patrol. Those two operations are one by ground and one by air. Right now, our ground forces, or our soldiers on the ground, have pushed further into the western part of the state, and by this afternoon, we should have guardsmen in every affected county, along with a liaison officer in these counties to help with communications, commodity distribution, and getting a sense of what is actually going on due to some of the lines of communication have been broken. Our air operation continues to operate, like the governor said yesterday. We delivered almost 200,000 pounds of food and commodities out of the Asheville airport. Right now, we're currently operating with 21 aircraft, and we have more on standby and some coming in this afternoon to help with this problem set that we have. I also would like to thank our civilian partners that are out there as well. Like I just mentioned, this is a team effort with emergency management, our highway patrol, our DOT, but most of all, thanks to the citizen soldiers that are out there every day. Some have not been home to their houses that have been damaged, and are helping others. So thank you, Governor.
Thank you, sir. I'd now like to ask our Transportation Secretary, Joey Hopkins, to share an update.
Thank you, Governor. As Governor Cooper mentioned, we were in western North Carolina yesterday, and we saw firsthand some of the devastation that they are experiencing out there. And our thoughts and prayers go out to all affected people. I want y'all to know that we're working day and night to remove trees and debris from the roads and highways. We have crews from across the state and contractors working just as hard as they can to do this. Unfortunately, some of our own employees are experiencing the same struggles as our citizens of western North Carolina. They have limited access or no access to food and water, and sometimes even fuel issues. We're sending supplies from other parts of the state so crews can continue to working on our roads, and we're working with other states to bring in other assets, such as temporary bridge materials, to assist in reopening damaged roads, and we're thankful for our partners in Florida for doing this for us. We've had many states reach out, our partners across the DOTs reach out and offer assistance. Right now, we have roughly 1,600 employees and over 75 contract crews directly assisting with these efforts, and more on the way. We have secured a location in Flat Rock to house up to 250 NCDOT and contract workers that are assisting these efforts, and we're hoping to move more people in as soon as we can increase housing. Due to communication and access issues, the ability to collect and even disseminate information about road closures has been hindered. We believe there are more road closures than are shown on the Drive NC website. However, that's the best information we have at this time. This morning, we're reporting 425 road closures, and we have already identified over 700 damaged sites. However, we're starting to see some progress on clearing, repairing, and even opening roads. Eastbound I-40 near Old Fort has now reopened, and we hope to reopen westbound I-40 in that same area today. I-26 is open throughout the state of North Carolina, and 421 is open to Boone and even past Boone toward the Tennessee line. However, we've got I-40 closed at mile marker 3 at the Tennessee line, and it will be for some time due to the extent of the damage. We're already looking at some options to stabilize the road that's left there, so hopefully we can start repairs just as soon as possible. At this time, we're still recommending a limit on travel in western North Carolina unless it's an emergency or you are assisting with recovery efforts. Travel in this area for non-emergency personnel is hindering needed emergency response. Also, I'd like to remind you, food, water, and even fuel is in short supply, so any additional needs on those resources hurts us too. We have issued emergency cellular alerts to motorists near the I-40, I-77 interchange, alerting them that travel is prohibited in western North Carolina and that we only want emergency or local traffic past that point. I do want to thank the Highway Patrol for manning that interchange for us during this closure. That was a huge effort, and I want to thank them for that. Our top priority is to open as many roads as we can so residents can get the supplies they need, and our utility partners can reach areas to repair their own infrastructure. I want to thank our many partners that are working along with our state to help alert motorists of dangerous road conditions and are also helping to clear trees and debris from the highways. There are many state partners that are helping in this effort. Some are like the North Carolina National Guard, the State Highway Patrol, local law enforcement, other first responders, and even private citizens are helping in those efforts. Our crews and staff are dedicated public servants and will remain working until the last road is reopened and travel is restored. This is one of the most catastrophic events, like has been said, that our state has ever seen or even that we've seen in our lives. Recovery will take time, and we appreciate your patience as we continue to assess and repair the roads and highways in western North Carolina. Thank you.
Thank you, sir. We'll now hear from our Health and Human Services Secretary, Cody Kinsley.
Thank you, Governor. The entire team at the North Carolina Department of Health and Human Services has made the health and well-being of Western North Carolinians our top priority. We are supplying and supporting healthcare facilities in the region, coordinating and staffing shelters across the state, and making it easier for people to get access to food and healthcare. There are 22 acute care hospitals in Western North Carolina. We have connected with every one of them to understand their power, water, food, medical supply, and staffing needs. As of this morning, 20 are on commercial power. The remaining 2 are on generator power. Many hospitals in the region are still on temporary water. We have activated 2 federal disaster medical assistance teams to help emergency departments at Mission Hospital and Blue Ridge Regional Hospital. With the large number of people that are showing up, we'll continue to support them with more support on the way. There are 91 nursing homes and 121 assisted living facilities in Western North Carolina. We have connected with each of them as well and are staying in close contact to ensure the safety and well-being of our elderly and disabled. Many of the facilities are still disconnected from commercial power and municipal water. We are supporting these facilities with the resources they need to support their patients and residents. We have supported 4 facilities in the region to transition patients and 3 more facilities in the region as well to other facilities in the state. For all healthcare facilities of every shape and size in the region, we are working with emergency management and the National Guard to use road and airdrops to get food, water, fuel, and other supplies to these facilities as quickly as possible. 6 water tankers and 4 large water storage units have been deployed to facilities, and over 190,000 pounds of food, water, and medical supplies have been delivered or airlifted to several locations, including critical healthcare facilities. We have activated statewide patient coordination and transfer systems using land and air assets to move critical patients to reduce pressure on Western facilities. Over 220 ambulances and 520 EMS personnel have been deployed to support patient movement. We know there is a significant need for oxygen in impacted communities. We have distributed 3 large shipments of oxygen and are working to secure more. We are also working to get oxygen available at centralized locations for individuals that are at home and oxygen dependent without power. Public health nurses have been deployed to help in shelters, and environmental specialists have been deployed to Western counties to conduct re-inspection so that flooded restaurants and hotels can reopen, and to assist with testing of private drinking water and wells to ensure that they are safe to operate. I want to remind people in Western North Carolina that drinking water may not be safe to drink from municipal sources or well water. Flooding damages infrastructure and wells with contaminants. Only use bottled, boiled, or treated water for drinking, cooking, and personal hygiene. We have 29 open shelters with over 1,000 people in those shelters. Those are being staffed through a combination of our state staff, county staff, and teams from the American Red Cross. We are working with the Department of Social Services in each county and public health offices in eastern North Carolina to identify additional volunteers to support Western shelters. We have 3 fixed sites delivering food to 30 different locations across Western NC. These deliveries are to shelters, fire departments, and churches throughout the region. We delivered 20,000 meals yesterday. We are working with our federal partners to automatically replace lost food for people who receive SNAP benefits and getting flexibility so that people with SNAP benefits can use those resources differently. We're also working with federal partners to temporarily provide food benefits to individuals and families that have been impacted who do not already receive SNAP. We have relaxed federal and state rules for healthcare facilities so that they can accept more patients when providing temporary shelter for evacuees from other facilities. Also, for people on Medicaid, you can now more easily get reimbursed for necessary services, get your prescriptions refilled early, and expedite nursing home admissions. We will continue to add more flexibility so that providers can act quickly and North Carolinians can get the health care they need. This storm has been catastrophic for so many North Carolinians. I and my team are committed to doing everything we can to help. There is real physical danger, and then there is an emotional toll as well from this storm. It is a traumatic event, and I want you to remember that there is no right or wrong way to feel at this time. If you need someone to talk to, call or text the Disaster Distress Helpline at 1-800-985-5990. Thank you.
Thank you, sir. Thank you, Secretary Kinsley. Now we're going to hear from Attorney General Josh Stein.
Thank you, Governor Cooper. First, I want to extend my prayers to all of the people who've been impacted by the storm, especially those who've lost loved ones. The scale of this crisis is beyond anything we've ever seen. I want the people of Western North Carolina to know that we are with you, and as you recover and rebuild, we will stay with you through the end. I also want to say a word about the first responders who've been working nonstop to rescue people, protect them, and provide them with the life-saving supplies that they need. I was with the Greensboro and Winston-Salem police chiefs yesterday, and both have sent or are sending officers to cities in the West to relieve those officers who were working under immense strain. I was struck by how calm and steady each of them was about their plans, because that's what law enforcement does. When people need help, our first responders step up. That's true of so many North Carolinians. They're doing everything they can to be helpful to those in need. We're seeing so many stores do everything they can to serve their communities, staying open at all hours, providing free water, and serving as impromptu community centers. But unfortunately, there are some bad actors who are out there trying to take advantage of this crisis to make an extra buck off of people's desperation. That's why North Carolina has an anti-price gouging law. And when Governor Cooper signed the state of emergency declaration, our state law was triggered. Charging too much for any needed good or service during an emergency is against the law in North Carolina. So if you think you see someone charging an unfair or excessive price for hotel rooms, gas or food, or emergency supplies like generators, file a complaint with my office at ncdoj.gov/price gouging, or you can call 877-5-NO-SCAM. We've received more than 70 complaints as of 9 a.m. this morning. About a third involved fuel, a third involved groceries, and a third involved hotel rooms. We're investigating these complaints, and we've already issued 3 civil investigative demands to businesses to determine if they are breaking our state law. If they are, we will not hesitate to take action. We've won back more than $1 million for North Carolina consumers and more than a dozen price gouging lawsuits since I took office a little over 7 years ago. We simply will not allow price gougers to take advantage of you when you're in need. Times like this ask the best of us. We take every opportunity to lend a helping hand to those in need. It's our moment to step up for our neighbors. There are so many ways to give: a blood donation or a financial one at nc.gov/donate. One thing I know about North Carolinians is that we are there for each other, that we look out for each other, and that's how we will come back even stronger. Thank you.
Thank you, Attorney General Stein. We'll now take questions from people in the room, and there's a mic over here. Sure, Gary.
Gary Robertson with AP. I know that the federal administration, a spokesperson yesterday said that there were as many as 600 people unaccounted for. Could somebody peel that back a little more? Was that for the region, and has that number gone down? If it was for the region, what is that number for North Carolina? If you could just talk about that.
Yeah. I'll let Director Ray talk about this more specifically, but we've created this 211 resource where people can call to report that they haven't been able to get in touch with somebody. We send that information out to local teams, local law enforcement. Welfare checks are made trying to find people. There are also people who get in touch eventually with the people who are lost or they haven't been able to get a hold of yet. And closing that loop on how many people have been successful in this, I think we don't have the quantity of that. But I'm going to turn it over to Director Ray, because I know they've been working on this issue because I've been asking about this issue.
Thank you, Governor. Gary, as he laid out, I think this is an important effort as we move through the response. I think we want to make sure we're working with our partners at 211 to get that actionable information, to get it to the responders on the ground, to be able to action it as quickly as possible. I think we can we can work with you offline on what that specific number may be. Right now, we are trying to get that information out as quickly as possible from 211 out to our responders in the field to be able to validate those individuals right now. Again, right now, our focus is on addressing life safety issues and making sure that those individuals that may be at risk or in need, that we can take care of them as well.
Adam?
Hey, has there been any thought given to bringing assets in from Fort Liberty or Camp Lejeune?
I discussed that yesterday with the president. He gave a green light. There is work that needs to be done, but yes, we're talking about bringing in assets from the military to help us.
What might those look like?
Well, first we're thinking about air assets in addition. We have a lot of assets coming in from all across the country. General Hunt is helping to manage that now, but we know that this crisis will likely be a sustained crisis because of water system issues. So we know that this is going to have to be a continuing operation. So I want to make sure we get every single resource that we possibly can into North Carolina for what may be a long haul to make sure that we're continuing to get water and supplies all across Western North Carolina.
Just one more kind of on the point you raised about this being a long-term response. What plan is there to get people out of the mountains, especially considering that water, power, food are scarce and sounds like going to be scarce for a while?
Will, I'll let you have it.
So great question. I think this is what has driven some of our distribution strategy right now for some of these critical commodities. Why we're looking at multiple ground options as well as air options and increasing those available platforms to do that air move to get resources into those impacted communities. The other thing is we're working with utility companies, DOT and the State Highway Patrol to help expedite some of the power restoration and debris removal missions so that we can start to see those power numbers continue to go down. Again, from the peak we saw of almost 1 million during this event to where we are now with, I believe, 420,000 was the number before we came in here. We've seen a significant improvement. We know we have a significant way to go in getting power restored. We're also looking at potentially bringing in, for the critical facilities and critical services, generator support, other ways to get power generation back on. I think as the administrator mentioned, we're looking at resources through the U.S. Army Corps when it comes to water system assistance, especially some of the larger and complex systems, to be able to bring those systems quickly back online. As Secretary Kinsley mentioned, we are already doing some very specific moves of licensed care facilities and healthcare facilities for those that need it. I think we all know that disaster survivors have better outcomes if you can remain in your community where your infrastructure and support system is. And so we're making every effort to allow folks to be able to remain in their community if it's safe and secure to do so. That's why we are really pushing and flooding the region with some of these critical commodities as we focus very directly efforts on both the telecom partners and bringing communications back online, as well as working to expedite power generation.
Jamise Price with ABC 11. So there is a major fear that the death toll will continue to rise. We know there are places that maybe crews have not reached yet. Talk us through that process of reaching those communities that you guys have not got to yet.
We have 92 search and rescue teams who are continuing to work to rescue people. We know that there will be more fatalities. I'm going to turn that over to Will Ray to give his comments about that as well.
Thank you, sir. So currently the state confirmed number on fatalities is 38. Again, we know we have seen a continued increase there. I think we're going to continue to work with our healthcare partners and make sure we have the right resources to support that effort as we are continuing response operations. In addition to the 92 teams from search and rescue that you mentioned, we are working with our partners from FEMA as well as surrounding states to identify additional search and rescue assets to bring in to really make sure we have a lot of teams conducting wide area search in the region. As General Hunt mentioned, we're increasing the number of aircraft. that we have available. And I would also like to stress, we have aircraft that are doing commodity lift missions out of Asheville. As a part of those commodity runs, they are doing surveys of communities that we have gotten reports of that may have impact issues or may have access issues or may have critical needs. And so I want to make sure folks understand that as we're moving water or food or fuel out, particularly those aircraft are actively surveying and evaluating some of those areas as a part of that move. And I believe General Hunt had shared both yesterday and today some of the statistics that the National Guard has on numbers of people that they have actually evacuated as a result of some of those surveys. So I just want to make sure folks understand, while commodities continue to be a major focus, search and rescue does as well. And while we are doing commodity runs and moves, we are also using those assets to conduct search and rescue operations. And in some places, there have been multiple evacuations out of communities. We are continuing to focus on getting more resources in to be able to get into those significantly impacted communities as quickly as possible.
When we talk about priorities and resources, would you say, like, which order does this fall into? Power, water? Like, which one are we trying to get accomplished first? I know it all works together, but
The number one priority is saving lives, and the search and rescue teams are continuing to work hard. We're even expanding those. Before I answer the rest of it, I wanted General Hunt to say a word or two about what they are doing. As Will mentioned, as they're bringing in commodities, they're also rescuing people as well. So General Hunt.
Yes, sir. Thank you for the question. So a little scenario. Yesterday we had a CH-47 out of Maryland, one of our National Guard partners who's here. They delivered 75 first responders to a site. And as they're flying, they picked up 20 people and relocated them and 6 dogs. And at the same time, that same flight, they also delivered commodities to a community. So it's not just one type of thing. All of our aircraft and all of our soldiers that are out there, they're prepared to relocate, search for personnel first, deliver commodities, and then again, they are our eyes and ears of what's going on out there. The National Guard have probably already rescued over 500 people. I mean, like Banner Elk, we helped evacuate Lee's McRae College with some assistance from our civilian friends that are up in that region as well. We delivered food and water for them, and then we helped relocate them to safety. So we do this on every single flight that we have. We're searching, we're providing commodities, and if we have to relocate personnel, we'll do that as well. Thank you.
And this is why it's a coordinated response, because everybody has their own assignments. But, making sure we're saving lives, but getting people essential needs, food and water and medicine, taking care of our vulnerable people. But we also have significant work in getting roads open and working to make sure that we are helping our utility partners to get cell phone communications back up, to get power back up. There are a myriad of challenges that this community is facing because everything was affected. Everything was devastated. And that's why you're seeing such a massive coordinated effort across the board to deal with all of those issues, because it's hard to name something where they don't need some help with it.
Thank you. Clifton Dowell from NC Insider State Affairs Pro. General, I'm wondering, we've heard some calls for more National Guardsmen, but more is not a number. How do you figure out what's the right size, and does it come in stages? How does it evolve over time? What would you predict for the future in terms of total numbers, that sort of thing?
Okay, that's an excellent question, because we can throw a lot of people onto the problem right now. For example, the aircraft. We have 21 aircraft flying in the valleys of Asheville. That's a lot of aircraft. We could put more in there, but now it becomes detrimental to what we're trying to do. Same way with people. It needs to be a coordinated event. I can bring on a lot of more soldiers, which we're doing today. But if we don't have the lines of communication open, we can't get there, which we're working on as we go through the western part of the state. I think to answer your question, the U.S. military and our friends at DOD, they're willing to provide resources, and we're going to tap on some of those as well. This is going to be probably a long-term event, so we will rotate our soldiers through. We have almost 10,000 Army soldiers and 1,200 airmen who have been actively engaged in some form. Our whole National Guard is on alert right now, so we can bring on more people. But when we bring on soldiers, we bring them on not just as a group. We're there to provide a specific mission or specific tasking, and that's what we design our force packages to do. Does that answer your question, sir? Thank you.